In keeping with the theme of this Congress, ensuring that we listen to a multiplicity of voices in this space, our next speaker, who will also, along with Nigel, be joining us in a panel after this, is from Egypt and gives us a voice that is more about, once again, the patient side, but particularly patient safety. Nagwa Metwally is very much involved in a program called the Patients for Patient Safety Program, something set up in 2005 by the World Health Organization. And rather than me filling this space with an explanation of what that involves, I'm going to get Nagwa to give us that information. So Nagwa.
Thank you very much. And I thank very much the organizer of the conference to invite me. Not only because this is a chance to see Australia, which is very far away from my country, but also because as a voice of patient. And this is, I consider it a success in a way, because the voice of patient is hardly heard. I will to talk about my experience as an advocate and a voice of patient. And actually in this field, I want to thank also Dr. Samin. He's here. He was always encouraging me and encouraging the ideas when he was in EMRO. So thank you so much. I will start by saying maybe some of you doesn't know Egypt well. I'm just telling you that Egypt, just a few words about Egypt in the beginning. Egypt is an African and Mediterranean country. It's one of the oldest civilizations in the world, as you know. It's full of diversity. Three nobles, Price, Sadat, Mahrous, and Zuwail, an Egyptian king, which is now the fashion of all the young, is Mo Salah in the football. Here is the map. You can see where is Egypt. It's it's on the Mediterranean in some part, and it's African on the south. And here is some photos and pictures about the Nile. And some of the, this is just to give you a short, very quick idea. I am a member of the High Council of Egyptian Red Crescent. And this one was actually an honorary thing, so I didn't want to be an honorary member. I thought about doing something which would make a difference. The Red Crescent was, from early beginning, was always interested in hospitals. So I said, okay, I will do something in the hospitals. Previous of that, I was president of Diplomatic Wife Association as a wife of a diplomat. So I took some of, when I finished this, I said, okay, I'll do something with the hospital. So some of the group of wife of diplomat came with me. And I thought, okay, I will start by going to the hospitals of the university, or medical school of university. I wanted to go to the hospitals of medical school for two reasons. It's a teaching hospital, so I wanted the student to have a good system when they are learning and in their early life. And at the same time, it is the public hospitals. This is the hospitals which those patients who are in a very low budget or they don't know where to go, they go to this hospital. So from all over Egypt. So in this case, we will help in two things. The Ain Shams Hospital is one of the largest, is the second university in Egypt. And to give you an idea about the patient in these hospitals, actually, this university was established in 1935, and it contains 6 big hospitals in all the specialization, in surgery, in heart, in psychology, in geriatric, in everything. And if you imagine the load on this hospital, you can feel the challenge to do something. It's the surgery, and there is 3,600 beds in these hospitals, and there are 300,000 every year patient going to these hospitals. There are 100,000 operations done every year. There is 1,500 outpatient every day. There are 250,000 patients are kept for operation. So this is all can just give you an idea the challenge in this hospital and how can you do something about it. Our goal when we first went to the hospitals, even my group was telling me, Nagwa, what we will do in the hospital? I said, I don't know. Actually, I didn't know. What I wanted to do is just to be the eye outside the hospital, outside those who are working in the hospital, which they don't see things, but the outside eyes can see these things, so we can help them in that. So, and also to bring, to take care of the patient especially. And I started by the gynecology hospital actually. And I wanted the gynecology hospital for two things: to take care of the mothers, because always people go to the children or whatever, and secondly, to take care of the child. And especially the mother who goes to these hospitals are coming from very far away from Egypt, and they don't have anyone relative with them, and they feel very much weak and shy and helpless. So we said we'll start by this hospital and see what we can do. We wanted to build a local awareness among patients about patient safety problem health service facility. We wanted to encourage participation of national health authorities in such Ministry of Health and Medical Syndicate and everything, to support national, regional, and global health care, to increase the level of awareness of patients as well. We're starting the volunteer program, and by recruiting people first, those who want to do something, and then we met with the Dean of Medical School, and this was, of course, important, so we can go to this medical school. We know how it is difficult to be among professors of medical schools, especially from outside. So we met with them, and we're starting to talk about what we will do. The reason also which I choose this hospital especially, okay, it's public, as I said, all this which you can read quickly. This is a picture of the group in the beginning. And this is what we will do, what we did in our work. We were working about this in the hospital, and the things which we didn't like it to be, we just put it in our mind, and we have a book. We write down all these mistakes, all the things which you don't like, and then after 1 week or so, we meet with the management, and then we discuss together what we can do about what we have seen. What we can do, it could be not fundraising only, because I don't like the word of fundraising. Fundraising is not everything. There is much more things which is more important than fundraising, is the relation between the patient and the caregiver. This is very important things. I liked very much lady which was talking in the opening and saying about the care and calm and accountability. This is what we need in the hospital, actually. It's not only fundraising, and it's not only equipment, it's not only thing. No, we need something else. We need this relation differently between the management, between the doctors, between the nurses, between the patient. All this circle should be a little bit of change, and to have some humanity in the relation with patient, some care, not only as a patient sitting on the bed that are an object or a case of study. No, because every one of us could be a patient one day. This is what you have to put in our mind. So we would take care of everything about infection control. If anyone is giving something, injection, for example, without the gloves, about equipment, about patient support, about cleaning of the clothes, about management, how they deal with the others and the staff, about the nurses and how they deal with the doctor and both of them with the patient. We were working in a team, actually. This is what is very important to succeed. So this is also some of the photo pictures. This is some of the outpatient, the relative of the patient outside. And I won't tell you how much they appreciate if you just go and tell them or talk to them or listen to the problem. And makes a difference. And it facilitates very much the treatment of the patient if the caregiver put this in their mind always. This is some of the hand hygiene campaign. And this is the book which we were putting our remarks. And this is when we were some problem which is facing some of the patient. And this is also, we took care of training. Training is very important. After our experience in the hospital, training is very important. Job description is very important because sometimes you say no. When you say something about nurses or anyone who's working in the hospital, she's not doing her work well. Why? And then the management will tell you, but she knows how. But the fact is she doesn't know. They don't know. They have to know well to train them on their job description, which is not there. Of course, the challenges was too much. The current situation was we have no culture, which we noticed during our experience. There is no culture of patient voice. There is doubt and suspicion in patient and staff mind of value of her voice. There is disregard of patient inquiries in their medical condition. There is patient suffering from incapacity of expression and loss of trust in healthcare system. And there is no human side factor in relation with patient. There is poor communication during nurses' shift, which is this is one of the challenges we are facing in our hospital. There is lack of interpersonal relation. There is a vicious circle of fear. There is patient right poorly understood. There is, well, as you can see, you can go quickly to the slides, so I don't take much of time. Also, there is no also involvement of key players. There is the economic part is still very poor. Patient fear, especially the poor, culture of blame, you can notice it very much. There is lack of serious punishment in our country. All these things and all these challenges, we were facing all these things. And the attitude, this is a big obstacle as well. How to change the attitude of those men. So we try to do some work about the attitude. And we understand that even the work overload of the residents and nurses in the hospital is one of the things which is not, it's in our hospitals in our area. There is, there is many things. I want to just look quickly so I don't go in items one by one. This is the challenge that we are facing in our countries. Also, patient rights are poorly understood, so they are not very much effective. Poor role of social worker in hospitals, lack of information for the patient. All these challenges were there, but it's never, you have to be patient so you can achieve your goals, and do it what we did. And I can say after 15 years now, there is some achievement happen. There is awareness of patient now in the hospital. There is a relation with patients, including student performance evaluation. Now the relation between the residents and the doctors, it's in their evaluation sheet during their exam, which was not there before. The staff now can talk about the problem, about the relation with patient. There is very much improvement in the relation between doctors and nurses. There is a patient safety program in hospital management. There is organizing training course, which was not there. There is many recommendations were adopted by the medical school professor. All this happened, which I can't believe that's happened after all these years. And something which is very important as well, for the first time in our country, the voice of patient is on the board of hospitals as a member. You know, the members are all our teachers, our professors. I am the only one which presenting the voice of patient in this board. And you know, it's like the army in the medical school, no one can go in. But thanks God, I succeeded. This is in the board of hospitals, and you can see there. And communication was established, the patient right was there. There is some of those posters everywhere now. There is a patient guide in the wall post. Patient safety is always in their mind. The awareness is there. The communication established. There is many things happen after all these years, which means that nothing is impossible. With patient and with passion, with dedication, you can reach your goals. Of course, I won't talk about our future plans because there is no much time. But I can tell you that the success formula after all these years is to put the patient top priority. The direct experience in connection with patient and staff, seeing in whole system. Being an NGO, but independent. Excellent contact, acceptance from the management and for everyone, support of senior management, this is very important. Part of regional and global network of patient for patient safety now, after 2005. And empowering staff and volunteer in decision, not afraid of making mistakes, learn from them. I finished already. Good idea shared with management, flexible, not imposed, and humanity in all our activities. And especially, it's a group work. No one can work alone. This is some of the photo during some of the workshop which we did. Some of our meeting with management and president of the university to talk about some problem about the hospital. And here is some with some patient. Here we did many. We give many equipment to the hospital, and only not this one. Now we are spreading all over the hospitals of the medical school. The last one was geriatric hospital, because I have a spot, a very soft spot for the elderly people and for the mothers especially. So this is some of the photos. And the hand hygiene campaign now every year is very well celebrating, even in the community around the hospital. This is one of the things which were around the computer, and this is some ideas which came from the nurses themselves in a competition between the hospitals about the hand hygiene. So this is some of the photos. And this is the last celebration, hand hygiene, 2018. And this is my experience. Thank you very much.